Hey guys, you guys asked for it and I delivered. Dr. Islam Reviews House, Episode 8, Season 6. Cue the music.
And action.
Oh.
Oh, what's wrong?
My eyes. I feel like they're exploding.
So he's describing what is called photophobia, where you actually have pain whenever with lightness. There are certain conditions in which you can have photophobia associated with that. Sometimes GI conditions can also be associated with this fear of light or just this painfulness whenever light comes in there. House! Love this intro. It's great.
3-month-old with fever, incessant drooling, and chronic muscle weakness.
Or porn actor Hank Hardwick, born Henry Lefkowitz, totally clean workup, collapsed on the job with extreme photophobia.
Or
Boom! Photophobia.
is a ragdoll.
Yeah.
What'd I say?
Wait till Jason Cameron get here. I have the feeling they'll have the good sense to side with me.
Run an STD panel on a tox screen, send a C-reactive protein to look for inflammation, and an ANA to screen for autoimmune. The rest of you take a history.
So CRP is a lab test that can sometimes detect inflammation. Now, that blood test is not very specific, but I use it a lot for my GI patients who have conditions like inflammatory bowel disease, like Crohn's disease, or ulcerative colitis, to give me a objective measure of inflammation to see if there actually is inflamed, but it's not very specific, and not everyone who has a high CRP has evidence of inflammation.
You ever get jealous when your wife's working? It's a job. Once you start letting your work life rule your home life, especially if you're in the same line of work, your relationship's gonna be short. You feel a little pressure.
So what he's doing a lumbar puncture, and what that basically is, he put a needle into the spinal column to get some fluid, and with that fluid you can test for viruses or infections. Typically though, and not in this case, it's a sterile procedure, so we usually are not in our regular suits. We gown up, we wear sterile gloves, we clean up the area in a clean fashion to make sure everything is sterile, because we're sticking a needle in someone's back, and obviously if you're not sterile, you can really put some bad stuff in there if you don't have a sterile field. So we don't just do this haphazardly, we really do make sure that the area is clean before we even start.
So you guys actually work together?
So I'm not sure exactly why they're doing this as opposed to just checking blood testing for vitamin D deficiency. We can just typically just check blood testing to see if that's low or not. So, but you know, I guess we have to take up time on a TV show to figure out why you're vitamin D deficient.
You don't get to make your own rules and morals.
Well, you're here to treat him, not lecture us about her. Hank, are you all right? Are you okay?
Just a nice
Ooh, nosebleed. That must mean something.
TKO hemorrhages.
We were wrong. So was form.
Doesn't work so well if you have a conscience.
Conscience. You mean that thing that kicks in when there's no logical reason to behave the way people want you to?
Uh-oh.
You have a fever.
Heart rate's going up.
Means the antibiotics aren't working.
I mean, something's going on. Some infection going on.
Mr.
Dismiss the she loves me theory.
Possible. It would require the presupposition that everything she's done for the last 6 years has been completely...
So usually we have specialists who specialize in ear, nose, and throat, infectious disease, gastroenterology like me, but obviously in-house, the fellows who are the ones that are in training are the ones who are doing everything, whether it's lumbar punctures, whether it's surgery, whether it's doing radiology. So just a little bit far-fetched. Typically we have specialties who specialize in those particular areas so that they can focus and train on that, not have one doctor do everything like this fellow is doing.
My stomach. Oh, it really hurts.
His liver's failing.
So they may be good, they may be really good, but I have never, ever seen anybody or heard of anybody who can tell that your liver is failing based on feeling your liver. She either has remarkable skills, she has x-ray vision, or that is not gonna happen ever again. So don't assume that just because I can feel your liver, I can tell if your liver is failing. Now there are signs that we can see that you have what's called liver failure or liver cirrhosis, things like ascites or fluid in the belly, yellowing of the skin, yellowing of the eyes, what are called spider angiomas, which are skin spots on your skin, or even dilated veins inside the belly that we can see. But that just that exam finding, that is not telling me that your liver is failing. Man, she is really good.
Enough! Stop pummeling 13 and Taub. It fits. Prep the patient for an ERCP. See if there's any hope of opening these locked bile channels. And tell them.
So what an ERCP is, it is a procedure that I actually do. What we basically do is we go down with the scope, and in that scope we actually go into the bile tracts to see if there are any narrowing that are there or any strictures that are there, which is what they're talking about, the condition called PSC, primary sclerosing cholangitis. Now, you don't need to do that procedure necessarily in ERCP to find this condition. You can also do a non-invasive test called an MRCP, which is a dedicated MRI of the biliary system to see exactly what's going on. So I'm kind of jumping the gun here and going straight to an invasive test, which is not something out of the ordinary, but there are other less invasive tests you can do instead.
We'll start looking for a liver donor.
I bet you they're gonna have the same fellow do this.
Chase.
We don't know how much the sclerosing cholangitis has damaged your liver. It might be in a year, it might be in 10. But the odds are you're going to need a new one. And you should know, while no transplant committee will say this openly, they'll never grant an organ to someone working in your profession.
Okay, I want to totally say that's not true. So there are certain criteria which are used for a liver transplant. Number one is what is called the MELD score, MELD, which is an objective scale to see how bad your liver is. Number two is the cause for liver disease. So for example, if you have an autoimmune condition like PSC, that may change the criteria versus a condition like alcohol, where if you're actively drinking, we typically don't have you on the transplant list, and there is some time of sobriety. Other factors, whether you're a porn star or a politician or just a regular old person, that really does not play any role in determining who gets a liver transplant. So I don't think that just because this guy is in the porn industry is automatically going to stop him from getting a liver transplant.
Passing the pancreatic duct.
Don't listen to House.
Alright, so that was the pancreatic duct, number one. That was the small intestine. Number two, the fellow is doing the procedure, even though the procedure is not done by an ID fellow or an infectious disease fellow. It's done by a GI doctor like me, had training for years who've done this. It's kind of very random that this guy does radiology, surgery, and GI. This he's amazing. He's like Superman.
I'm in the common bile duct.
What's that mass? Gallstone?
Magnify ×5.
Alright, that was not the common bile duct, that was still the small intestine, and they were trying to get into one of the ducts.
That's not a gallstone.
Ooh, is that
It was
worms?
completely filled with worms.
Oh! Ooh!
You know, this is the doctor's lounge.
I know. It seemed like the place to read doctor's notes. You are good at it, by the way.
So that's illegal. Number one, no non-person in the medical field can read a chart. Number two, you have to be actively engaged in the care of the person to get in somebody's chart. So for example, if I'm taking care of a patient, I can get access to the chart because it's my patient. But if there's another physician who is not on the case, but they want to see the chart, they can't. That's illegal. We don't do that. So it's a clear violation of HIPAA, irregardless of the fact this guy's not even a doctor or even in the healthcare field.
What if it's lymphoma? Peritoneal carcinomatosis explains liver failure. Paraneoplastic Syndrome explains everything else.
Lymphoma it is. Brought him for chemo. Facts, Tal.
So that's pretty dramatic. You don't all of a sudden think that the person has lymphoma and then automatically go to chemotherapy. There's a process, whether it's imaging, lymph node biopsy. That is pretty dramatic, man. Oh my gosh. I think you have lymphoma. You will get chemo. That is the end, because I am house. Wow.
Those threadworms, why would his body have gone to hell just hours after they were gone?
The worms weren't hurting him, they were helping him. He has extra-intestinal Crohn's. He got it from being raised in too clean, too overprotective of an environment.
It's the hygiene hypothesis, why there's so much autoimmune disease in the developed world and almost none in the developing world.
The worms were keeping the Crohn's.
So let's talk about the hygiene hypothesis. This is a real hypothesis in which we think because we grew up in a clean Western world, a lot of the diseases that we are currently facing, autoimmune diseases, allergies, asthma, things like that, even Crohn's disease, are becoming more and more frequent because we were not exposed to the typical bad bacteria, bad allergens when we were growing up. And so the thought is the more cleaner we are, the worse it actually has been for our overall health. And this is what they're talking about when they talk about the hygiene hypothesis. Now, this hypothesis has been around even for conditions like Crohn's disease, where we think that, and it's not true, we don't have very good evidence for this, but we think that because we're in such a clean environment that we're more likely to develop things like Crohn's disease, ulcerative colitis, and other autoimmune conditions. So in this episode of House, they actually had a patient who was diagnosed with Crohn's disease, but the symptoms were extra GI related, including things like joint pain, eye pain, even liver issues as well. Now, this condition called primary sclerosing cholangitis is commonly associated with conditions like ulcerative colitis or Crohn's disease. The thing about this case is that they didn't have a lot of GI symptoms. Mainly the symptoms from Crohn's disease include things like diarrhea, pain, weight loss, night sweats, things like that. And usually we can diagnose that with a colonoscopy or imaging, but obviously with this particular episode they decided not to do that. But this is my reaction to House. If you like this video, I would encourage you to comment down below. Let me know what videos or series you want me to react to or comment to. Comment down below. Don't forget to like my YouTube page, and I look forward to seeing you guys on more videos. Hey guys, thanks for watching this video. Click here to subscribe to more videos, and click here to see more videos on my reaction. Thanks and take care.